Pituitary tumor or pituitary adenoma is a tumor that comes from the pituitary gland. 20% of the population can have pituitary tumors, but they live an entire lifetime and not aware that the tumor is present. The tumors are benign, and so they don't spread to other parts of the body, but because of where they're located and its proximity to other parts of the brain, as it grows, it can put pressure on those important structures, and you can become symptomatic that way. Women will get an irregularity of their menstrual cycle or lack of periods or menstrual cycle. They can also get enlargement of their breasts or milk discharge from their breasts. Men can have a decreased libido or gynecomastia, which means enlargement of their breasts. You can get symptoms what are called thyroid toxicosis, which is just a fancy way or medical way of saying excessive thyroid production, which can give you weight loss, sweating, and other symptoms. If you have growth hormone, excessive production of growth hormone in pediatric population, you can get gigantism. If the tumor does not secrete a hormone and it just grows larger, you can get symptoms such as headaches, visual problems, not so much blurry vision, but loss of peripheral vision. There are two ways or different ways to treat. If it does secrete an abnormal hormone, sometimes we can give medicine to help block that hormone production, which can shrink the tumor. But the majority of the time we have to do surgery, and the surgery entails where we go through the nose. So we go through the nose with a camera, and then through the nose we can get to the base of the skull where the tumor lives, and with this camera and with very fancy small instruments, making no incision on the outside of the head, go in through the nose into the base and take the tumor out. Post-operative recovery is actually not as complicated as many of the brain surgeries we do, because again, we go through the nose. There's no outside incision. It's really a very elegant way to get to this area, to the tumor. The patient usually comes in the day of surgery and they stay a few days, 2 to 3 days after surgery, then they go home. We have them take it easy for roughly 10 days to 2 weeks and then slowly resume their normal activity.